As the pandemic continues to spread across Europe, many people are asking if the region's leaders can bring the surge in COVID cases back under control. Well, this afternoon, European parliamentarians are meeting in Brussels. They're discussing just that, following these stark warnings we've had from the World Health Organization, who say Europe and parts of Asia could reach 2.2 million deaths by March next year. And that has prompted governments to take some fresh measures. More are expected to follow. Let's show you Austria, which this week became the first EU country to reintroduce a nationwide lockdown. People are only allowed to leave home for essentials, but the daily average there, over 14,000 new cases. Germany, among several nations, could soon be making booster jabs a requirement to be considered fully vaccinated. Almost 50,000 new infections have been reported there daily. And in Russia, we're seeing a daily death toll now, recently topping 1,200 people, 36,400 new infections being reported on average every day in Russia. Several countries, though, have seen really fierce protests against any new measures or restrictions. The Netherlands seeing several nights of rioting. The daily average there, around 21,900 new cases. Let's take you live now to St. Petersburg. Dr. Hans Kluge is the World Health Organization's Regional Director for Europe, often speaking on these issues. He's the man who can give us some answers to some very pressing questions, Hans, because I think many people know that vaccinations are the way out of this crisis. But when you've got a country like Germany accepting that they can't change the minds now of people who haven't been vaccinated, is it time for Europe to have a compulsory vaccine mandate?
We have to remember what the vaccines are achieving. The vaccines, in fact, never promised to cut the transmission. It protects against severe disease, against death, against hospitals being overwhelmed. But vaccines alone are not going to curb the pandemic. We need a vaccination plus path. 5 stabilizers. The first one are the masks. Only 48% of the European population is using a mask indoors. Any level above will have an immediate impact. Second is ventilation, particularly with the winter coming. Third one is vaccination. And we need to work more with behavioral and cultural scientists, make use of COVID passes and influencers, particularly for youth. The fourth is a booster, especially for the immunocompromised, the healthcare workers, the elderly. And the fifth is taking advantage when we have new medicines. That's the 5 stabilizers.
I think we can accept those other measures, Hans, but there is a clear link between countries with low vaccination rates and high COVID rates. Should there be a compulsory mandate now?
Well, this needs to be looked at country by country. And we have to learn the lessons from the past. We know that mandatory vaccination can increase skepticism. It can lead to lack of trust and social exclusion. There's 3 C's that we have to take in mind: the convenience, the confidence, and the complacence. So before going there, we have to be sure that we have done everything possible to convince the people and that there are no barriers to access. And it needs to be done in the legal framework and the cultural framework of a particular country.
What about the language and messaging around vaccinations, though? We saw Germany's health minister yesterday saying by the end of winter, everyone will either be vaccinated, cured or dead. I mean, the warning doesn't get more starker. The language doesn't get more firmer than that. How does the messaging around vaccinations need to change?
So that vaccines save lives. The majority of the people, the unvaccinated, are not hardline anti-vaxxers. They're people sitting on the fence. They have legitimate questions. And those questions need to be answered, and we have to focus on those. But at the same time, we need more than vaccines. We need to put the preventive measures in place, like I was telling, the masks, the ventilation, and also new treatment protocols.
Hans, in many European countries, they're talking about perhaps the inevitability of complete lockdowns like we've seen in Austria starting this week. When those kind of restrictions are being considered, should it be about ICU capacity rather than infection rates?
Well, we know that by the 1st of March, 49 countries are going to face high or extreme pressure on the intensive care units. 25 countries of the 53 will be threatened to be overwhelmed in their hospitals. So in that sense, it comes back to the basics that if lockdowns are implemented, try to keep the schools open, take care of the mental health, that's something we learned, and very important, to take care of the other diseases. Already we have worrying figures on an increase in incidence of cancer because screening services are stopping, and also of domestic violence, including intimate sexual violence. So we need to put those preventive outreach measures in place.
So, Hans, on that issue of children being back at school, which I think everyone accepts is important to keep kids back in school, should children across Europe be vaccinated from a young age?
Well, we are definitely eagerly waiting on approval of any vaccines for the younger children. Meanwhile, schools have to put the same preventive measures in place, including, according to the national and subnational epidemiological situation, masks for children as well.
Hans Kluge, thank you very much for joining us from St. Petersburg.